Delta has quickly become the fastest spreading variant in the U.S. and in North Texas. Right now, the Delta variant is responsible for as much as 40% of all COVID cases in the area, and it's expected to hit 50% over the next few weeks. That's according to Parkland's chief medical officer. Medical City and Cook's Children's are also reporting an increase in cases.
It's a much greater risk of transmission than the original variant or even the UK variant.
Dr. Mark Casanova serves on the Texas Medical Association's COVID-19 task force and says Delta, which originated in India, is proving to be tricky to identify.
It's not going to be a dramatic difference in symptoms for the Delta variant versus the common cold, the common flu, or the prior COVID variant. What is the difference, however, is the severity of the symptoms.
With Delta, he says people are getting sicker faster, and the variant appears to be affecting a healthier population.
An individual may say, well, I'm young, I'm healthy, I think I'm at low risk. There's no such thing as what we're seeing right now with this Delta variant.
A new variant and a new push to get vaccinated, which doctors say may be more important now than ever before.
So take-home message is, yes, vaccines are protective. If we lag behind, we only give this virus ample opportunity and every ingredient it needs to either persist and mutate and get stronger in COVID-19's case.
In Dallas, I'm Charlotte Huffman.
You know, we're also seeing a rise in the COVID positivity rate, which is the number of people who test positive out of everyone who takes a COVID test. It just soared past 6% in Texas, a rate we haven't seen since the middle of March, when vaccines were obviously in limited supply. We know it's a lot to keep up with, so we're making it easy and compiling all our Delta variant information in one spot. If you want to learn more about the strain itself or its symptoms, text the word Delta to 214-977-6028. We'll send that info right to your phone.